Hypertension. Definition: hypertension, commonly referred to as high blood pressure, is a chronic medical condition in which the force of the blood against the walls of the arteries is consistently elevated. It is a significant risk factor for cardiovascular diseases, stroke, kidney disease, and other health complications. Types of hypertension. 1. Primary essential hypertension. Most common type 90 to 95% of cases. No identifiable cause develops gradually over years. Linked to genetic factors, lifestyle, and environmental influences. 2. Secondary hypertension. Caused by an underlying condition such as kidney disease, hormonal disorders, for example, hyperaldosteronism, pheochromocytia, obstructive sleep apnea, certain medications, for example, SANs, contraceptives, sudden onset and more severe than primary hypertension. Classification of hypertension: blood pressure levels. Category: systolic MEF Jang, diastolic MEF Jang. Normal 120/80. Elevated 120/129/80. Hypertension stage 1 130/139/80/89. Hypertension stage 2. Hypertensive crisis 180/120. Causes and risk factors. 1. Non-modifiable risk factors. Age, genetics and family history. Race, ethnicity, higher prevalence in African Americans. 2. Modifiable risk factors. Unhealthy diet, high sodium, low potassium. Obesity. Sedentary lifestyle. Smoking and alcohol consumption. Stress. Symptoms. Hypertension is often called the silent killer because it typically has no symptoms. Severe cases may present with it: headaches, dizziness, shortness of breath, chest pain, vision problems, nosebleed, and hypertensive crises. Complications: cardiovascular, heart attack, heart failure, left ventricular hypertrophy, neurological stroke, transient ischemic ataxia, renal, chronic kidney disease, kidney failure, ophthalmic hypertensive retinopathy, vascular aneurysm, peripheral artery disease. Diagnosis: 1. Blood pressure measurement using a sphygmomanometer nor automated device. 2. Multiple readings over time for confirmation. 3. Tests to identify secondary causes or organ damage. Blood tests, for example, kidney function, cholesterol levels, urinalysis, ECG or echocardiogram. Imaging, for example, ultrasound of kidneys. Treatment: 1. Lifestyle modifications. Dietary changes: diet, low sodium intake. Regular exercise 150 minutes week of moderate intensity. Weight loss. Stress management. Smoking cessation and alcohol moderation. 2. Medications. Diuretics reduce fluid retention, for example, hydrocolloidal. ACE inhibitors relax blood vessels, for example, enalapril. ARBs, angiotensins and receptor blockers similar to ACE inhibitors, for example, losartan. Calcium channel blockers prevent calcium from entering heart artery cells, for example, amlodipine. Beta blockers reduce heart rate and output, for example, metformin. 3. Regular monitoring and follow-up. Regular blood pressure checks. Monitoring for medication side effects and organ health. Prevention. Adopt a healthy lifestyle early. Regular health checkups. Awareness of risk factors and early management. Prognosis. While hypertension is a chronic condition, effective management can significantly reduce the risk of complications and improve quality of life.